बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लि व सल्लिम अलैहि. Dear colleagues, this is female patient, age is 45, with history of bilateral flank pain, vague pain, and the urinary discomfort. So I'm going to scan directly right renal area. Here we can appreciate this right kidney showing the mild hydronephrosis. And also we can appreciate this one is the renal pelvis and ureter is going out. Ureter is connecting here, and it means that hydroureter is also present. So I am going to scan the left side, left renal area, and here we can also appreciate hydronephrosis. This one is the ureter, so hydroureter is also present. So there are bilateral hydronephrosis and hydroureter. These are the iliac vessels, and this is the ureter. We can appreciate. It means the still hydroureter is present up to the iliac vessels. This is the left dilated ureter crossing the iliac vessel, and it is also going toward the pelvic region. So I am directly going to the pelvis. This is the urinary bladder. Look at the urinary bladder. It is almost pear-shaped, and if we closely appreciate, the posterior aspect of the urinary bladder is conical. There is gradual, look at here, gradual narrowing of the posterior aspect of the urinary bladder. Although the posterior wall or posterior aspect of urinary bladder should be flat like this, when we come across with the normal urinary bladder, we daily appreciate the flat such orientation of the posterior aspect of urinary bladder. Here that is the conical, gradual narrowing of the posterior wall of the posterior aspect of the urinary bladder. So this is definitely the cystocele. Cystocele has such appearance when we do the transabdominal ultrasound with a low frequency probe. Now this is a female patient. I will now have examined over the uterus. This is the uterus, and this is the fundus of the uterus. This is the body. Look at the anatomical position of the uterus. Fundus and body is lying posterior to the urinary bladder. This is the transverse section. I am now going to see it in the sagittal section. Now look here, fundus, uterine body lying posterior to the urinary bladder, and this is the cervix, which is lying below from its normal location, anatomical location. So whenever such presentation is present in the transabdominal scan, this means that this is the uterovaginal prolapse, and such presentation with gradual narrowing of the bladder is present. It is the cystocele. So this patient is, we have already discussed a case like this. So this patient is having cystocele and the uterovaginal prolapse. So why there is a bilateral hydronephrosis and hydroureter? I'm going to trace it. Look here. This is the dilated ureter, distal ureter on the on the left side. And if we closely observe, due to the descent of the uterus, prolapse of the uterus, this uterus, the body of the uterus is compressing it. This one. This is the uterus. So here is the compressing it. Due to which there is a left-sided hydronephrosis and hydroureter. This one here you can appreciate. And now I am going to check the right ureter, distal ureter. This is the distal ureter. There is no color within the ureter. So this ureter is also passing here, and it is going just below the body of the uterus. So this body on this side is also compressing the ureter right-sided, and this ureter is also compressed the body of ureter. So due to the prolapse of the uterus is compressing both distal ureter, resulting in the bilateral hydronephrosis and hydroureter. So this was the case of cystocele, another case, and uterovaginal prolapse complicating to bilateral hydronephrosis and hydroureter. Thank you very much.